Next topic, inspiratory reserve volume. Inspiratory reserve volume or IRV is a respiratory parameter that represents the maximum amount of air a person can forcefully inhale after a normal tidal volume inhalation. It is the additional volume of air that can be inspired beyond the tidal volume during maximum inspiration. IRV is an important component of pulmonary function tests and provides insights into lung function and inspiratory capacity or respiratory capacity. The normal value of inspiratory reserve volume can vary depending on various factors such as age, sex, height, weight, and overall health. On average, the inspiratory reserve volume for an adult ranges from about 2,000 to 3,000 milliliters or ml. However, it is important to note that individual variations exist and the normal range can be influenced by factors such as body size and physical fitness. The inspiratory reserve volume represents the capacity of the lungs to take in additional air during maximum inhalation. It reflects the strength and efficiency of respiratory muscles, particularly the diaphragm and intercostal muscles. The inspiratory reserve volume can be influenced by factors such as lung compliance, airway resistance, and effort of respiratory muscles. Then measurement of inspiratory reserve volume is typically performed using spirometry, a common pulmonary function test. During spirometry, a person takes a deep breath after a normal tidal volume inhalation to measure the maximum volume of air inspired. The inspiratory reserve volume is one of the parameters recorded during spirometry and provides valuable information about lung function and respiratory health. Assessing the inspiratory reserve volume can help healthcare professionals evaluate lung capacity and respiratory muscle strength. Deviations from the normal range of inspiratory reserve volume may indicate underlying respiratory conditions such as restrictive lung diseases or respiratory muscle weakness or weakening. Then, monitoring changes in inspiratory reserve volume over time can assist in diagnosing and managing respiratory disorders and evaluating the effectiveness of interventions or treatments. So, in summary, inspiratory reserve volume is the maximum amount of air that can be forcefully inhaled after a normal tidal volume inhalation. The normal value of inspiratory reserve volume ranges from approximately 2000 to 3000 ml in adults. It reflects lung capacity and respiratory muscle strength. Measurement of inspiratory reserve volume using spirometry is a valuable tool in assessing lung function and diagnosing respiratory disorders. Then, expiratory reserve volume and normal value. Expiratory reserve volume is a respiratory parameter that represents the maximum amount of air a person can forcefully exhale after a normal tidal volume exhalation. It is the additional volume of air that can be expelled from the lungs beyond the tidal volume during maximal expiration. ERV is an important component of pulmonary function tests and provide insights into lung function and respiratory capacity. The normal value of expiratory reserve volume can vary depending on various factors such as age, sex, height, weight, and overall health. On average, the expiratory reserve volume for an adult ranges from about 700 to 1200 milliliters. However, it is important to note that individual variations exist and the normal range can be influenced by factors such as body size and physical fitness. The expiratory reserve volume represents the capacity of the lungs to expel additional air during maximal exhalation. It reflects the strength and efficiency of the expiratory muscles, including the abdominal muscles and the muscles of the chest wall. The expiratory reserve volume can be influenced by factors such as lung compliance, airway resistance, and the effort of respiratory muscles. Then, measurement of expiratory reserve volume is typically performed using spirometry, a common pulmonary function test. During spirometry, a person takes a deep breath in and then forcefully exhales as much air as possible to measure the maximum volume of air expelled. The expiratory reserve volume is one of the parameters recorded during spirometry and provides valuable information about lung function and respiratory health. Assessing the expiratory reserve volume can help healthcare professionals evaluate lung capacity and respiratory muscle strength. So, in summary, expiratory reserve volume is the maximum amount of air that can be forcefully exhaled after a normal tidal volume exhalation. The normal value of expiratory reserve volume ranges from approximately 700 to 1200 ml in adults. It reflects lung capacity and expiratory muscle strength. Measurement of respiratory reserve volume using spirometry is a valuable tool in assessing lung function and diagnosing respiratory disorders. Then residual volume. Residual volume is the volume of air that remains in the lungs after maximum exhalation. It represents the amount of air that cannot be expelled from the lungs even with maximum effort. Residual volume is an important parameter in assessing lung function and understanding respiratory physiology. The normal value of residual volume can vary depending on various factors such as age, sex, height, weight, and overall health. On average, the residual volume of an adult ranges from about 1000 to 1200 milliliters. However, it is important to note that individual variations exist and the normal range can be influenced by factors such as body size, lung elasticity, and airway resistance. The residual volume plays a critical role in maintaining lung function and preventing lung collapse. It serves as a functional reservoir of air that keeps the alveoli open between breaths. The elastic recoil of the lungs and the surface tension of the alveoli contribute to the maintenance of residual volume. Measurement of residual volume is challenging to perform directly in a clinical settings. Techniques such as body plethysmography and nitrogen washout can be used to estimate residual volume. This method involves complex calculations and requires specialized equipment. Alternatively, indirect methods such as using spirometry data and mathematical equations can provide an estimation of the residual volume. The residual volume has important implications in respiratory physiology and the diagnosis of lung disease. An increased residual volume may be observed in conditions such as chronic obstructive pulmonary disease or emphysema, where there is air trapping and decreased lung elasticity. Conversely, a decreased residual volume may occur in a restrictive lung disease or conditions where lung compliance is reduced. Understanding the residual volume is crucial for assessing lung function and diagnosing respiratory disorders. It provides insights into the overall volume and mechanics of the lungs. By evaluating changes in residual volume over time, healthcare professionals can monitor disease progression, evaluate treatment effectiveness, and make informed clinical decisions. So, in summary, residual volume is the volume of air that remains in the lungs after maximal exhalation. Then, functional residual capacity. Functional residual capacity is the volume of air that remains in the lungs at the end of a normal passive exhalation. It represents the balance between the inward elastic recoil of the lungs and the outward elastic recoil of the chest wall. FRC is an important parameter in assessing lung function and understanding respiratory physiology. The normal value of functional residual capacity can vary depending on various factors such as age, sex, height, weight, and overall health. On average, the FRC for an adult ranges from about 2200 to 2700 milliliters. However, it is important to note that individual variations exist and the normal range can be influenced by factors such as body size, lung compliance, and airway resistance. Functional residual capacity is determined by the balance between two opposing forces. The tendency of the lungs to collapse inward, lung elastic recoil, and the tendency of the chest wall to expand outward, chest wall elastic recoil. These opposing forces create a state of equilibrium, resulting in resting position of the respiratory system. So, measurement of functional residual capacity can be challenging to perform directly in a clinical setting. Techniques such as body plethysmography, helium dilution, and nitrogen washout can be used to estimate FRC. These methods involve complex calculations and require specialized equipment. Then inspiratory capacity. Inspiratory capacity or IC is a respiratory parameter that represents the maximum volume of air a person can inhale from the end of a normal tidal expiration. It is an important measurement in assessing lung function and respiratory health. The normal value of inspiratory capacity can vary based on various factors such as age, sex, height, weight, and overall health. On average, the inspiratory capacity for an adult ranges from about 3000 to 3500 milliliters. However, individual variations exist and the normal range can be influenced by factors such as lung compliance, airway resistance, and respiratory muscle strength. Then inspiratory capacity is determined by the sum of two lung volumes, tidal volume and inspiratory reserve volume. Tidal volume represents the volume of air inhaled and exhaled during normal breathing, while inspiratory reserve volume represents the maximum volume of air that can be inhaled after a tidal inspiration. Therefore, inspiratory capacity is calculated as the sum of tidal volume and inspiratory reserve volume. Measuring inspiratory capacity is a straightforward process, unlike some other processes, and can be performed using a spirometer, which is a device that measures lung volumes and capacities. The individual is instructed to take normal tidal breath and then perform a maximum inhalation until no more air can be drawn in. The volume of air inhaled during this maneuver represents the inspiratory capacity. The inspiratory capacity is clinical in significance in assessing lung function and diagnosing respiratory disorders. It provides information about maximum inhalation capacity of an individual and can help evaluate the adequacy of their respiratory reserve. Vital capacity, or VC, is a respiratory parameter that represents the maximum volume of air that can be forcefully exhaled after a maximum inhalation. It is a crucial measurement in assessing lung function and respiratory health. The vital capacity of an adult ranges from about 3 to 5 liters. Vital capacity is also used in the assessment of fitness levels and pulmonary function testing. It is often measured along with other respiratory parameters such as forced expiratory volume in 1 second and forced vital capacity to evaluate lung function and diagnose respiratory disorders. Next, total lung capacity. Total lung capacity, or TLC, is a respiratory parameter that represents the maximum volume of air that the lungs can hold after a maximum inhalation. It is the sum of all the lung volumes and capacities and provides a measure of the total amount of air that can be accommodated in the respiratory system. The normal value of total tidal capacity can vary depending on factors such as age, sex, height, weight, and overall health. On average, the total lung capacity for an adult ranges from about 4 to 6 liters. However, individual variations exist, and the normal range can be influenced by factors such as lung compliance, airway resistance, and body size. To measure total lung capacity using body plethysmography, adult individuals sit in a closed chamber and perform breathing maneuvers against a closed airway. Changes in pressure within the chamber are measured, allowing the calculation of lung volumes and capacities, including total lung capacity.